Today I'll be demonstrating the use of a heating pad, which is a superficial heat modality. It works through conduction, which means heat transfers directly from the pad onto the skin and tissues. The effects of using superficial heat is that it increases blood flow, it decreases muscle spasm, it increases tissue flexibility, and it aids in pain reduction. However, the contraindications for using superficial heat are impaired sensation, impaired circulation. It should not be used during acute injuries or acute inflammation, as well as if the patient has a fever or has any open wounds. Before providing treatment, I would evaluate the patient's goals and make sure the pathology being treated is actually aided by superficial heat. This patient has chronic back stiffness, therefore this will work and will not cause any adverse effects. To begin, I would explain to the patient what modality I'm using, how the modality will benefit them, and I'd explain that this is meant to relax your muscles and help with muscle improvement. To begin applying this modality, I'm going to ask that the patient lays on her stomach, as this is for a low back pain. Before beginning any further treatment, I'm going to ask for consent to touch you.
Yes, you're allowed to.
Okay, for this modality, I will be lifting up the patient's shirt to avoid dampness. Before placing the heating pad, we will place a towel in order to prevent burning of the skin and for comfort. And then we will place the heat pad. This is placed inside of either a terry cloth or another towel, despite the towel on top of the skin, also to prevent patient burning. Once the treatment is on, I would check with the patient within a few minutes to make sure that the warmth isn't causing any burning sensation and is still comfortable. Typically, the treatment lasts anywhere between 15 to 20 minutes, but it is up to the patient's comfort. Once it is time to remove the treatment, I will remove the heating pad, remove the towel, and then I would check the patient's skin for any redness or anything indicating a burn. To conclude, I would advise the patient to not use another heating modality too soon and to avoid any heavy activities to avoid overstretching of the muscle. Finally, I would document this patient's treatment session and have them report how they're feeling post-session and come back to schedule another.